Let's take a deep breath together, because what I'm about to talk with you about today could change the way you think about your health and possibly save your life or the life of someone you love. Kidney disease is often called silent, and for a good reason. It doesn't always cause pain. It doesn't always make a sound. But what many people don't know is that there are clear signs you can actually see, changes in your body, clues your body gives you, and when you understand what to look for, when you know how to read those signs, you can catch kidney disease early. And that's the key. Early detection gives you a real chance to stop it in its tracks, to protect your kidneys, and in many cases to reverse the damage before it's too late. Kidney disease affects over 37 million people in the United States alone, and millions more around the world. Yet most of them don't even know they have it. That's the frightening part, because your kidneys don't just help you urinate. They are deeply involved in how your body works. Every minute of every day. They clean your blood. They filter out toxins. They regulate your blood pressure. They control your levels of minerals like sodium, potassium, and calcium. They even influence your bone strength and your red blood cell count. So when your kidneys begin to struggle, the effects ripple out into every part of your body. Now here's what I want to share with you. Kidney disease does not begin with dialysis. It doesn't begin with kidney failure. It begins much earlier, often with small, gradual symptoms that you can see if you know what to look for. I'm going to walk you through these signs today. Not in a way that scares you, but in a way that informs you, empowers you, and gives you a clear roadmap for what to notice, what to ask your doctor about, and what you can do to protect your kidneys starting right now. The first thing I want to explain is why your body gives visible signs when your kidneys are under stress. Your kidneys work silently behind the scenes, but when they aren't functioning well, waste starts to build up in your blood. That affects your skin, your eyes, your energy, your appetite, even your sleep. All these changes can become visible if you pay close attention. And they're not random. They're your body's way of asking for help. One of the first signs many people see is swelling in the ankles, feet, or lower legs. When your kidneys aren't filtering properly, fluid begins to build up. This can look like puffiness in the ankles or shoes feeling tighter than usual. Some people see swelling in their hands or around their eyes, especially in the morning. That puffiness around the eyes may be one of the earliest visible signs because the tissue around your eyes is very soft and reacts quickly to fluid shifts. Another clear sign is changes in your urine, not just how often you go, but what it looks like. If your urine becomes foamy or bubbly, that can be a sign that protein is leaking into your urine, something your kidneys should normally prevent. If your urine is darker than usual or has a reddish tint, that may be blood, another warning signal that your kidneys are under strain. Going to the bathroom more often, especially at night, can also be a symptom. As your kidney function declines, it can change the way your body manages fluid and waste, leading to more frequent urination, sometimes in small amounts. Fatigue is another visible sign, though people often overlook it. When your kidneys don't function properly, your body may produce fewer red blood cells. That leads to a condition called anemia, and it means your muscles and brain aren't getting the oxygen they need. You may feel tired, weak, or short of breath. Even when doing things that used to be easy, you may notice pale skin or even dizziness. And this isn't just everyday tiredness. It's a deep, persistent fatigue that doesn't go away with rest. Let's talk about the skin. Dry, itchy skin can be another sign your kidneys are struggling. When waste builds up in the blood, it can irritate your skin and make it feel rough or itchy. Sometimes this itch is intense, especially on the back, arms, or legs. You may also see changes in the color of your skin. Some people develop a yellowish or grayish tone. Others may notice darkening in certain areas. These are signs that your body is having difficulty clearing toxins, and your skin is showing you. Another sign is muscle cramps, particularly in the legs. When your kidneys don't maintain the proper balance of minerals like calcium, potassium, and magnesium, your muscles can become irritable. These cramps can come on suddenly, even during sleep, and they can be painful. If you notice frequent leg cramps or spasms, especially combined with other signs, that's something worth talking about with your doctor. Changes in appetite are also worth noticing. People with declining kidney function often lose their appetite. They may feel full faster, experience nausea, or even have a metallic taste in their mouth. This happens because waste products start accumulating in the blood and interfere with digestion and taste. You might notice you're eating less without trying, or losing weight unexpectedly, or you may notice food no longer smells or tastes right. These small changes matter, and they are often the first clue that something deeper is going on. Bad breath is another visible sign. When toxins build up, they can affect your breath. Some people describe it as having a urine-like or ammonia smell. Others may have persistent dry mouth or trouble producing saliva. These oral signs are not just about hygiene. They reflect what's happening inside your bloodstream, and your kidneys are directly involved. Let's talk about sleep. Trouble sleeping or waking up frequently at night can be linked to kidney issues. This happens for two reasons. First, waste buildup in the blood can make it harder for your brain to rest. Second, kidney disease can increase the risk of sleep apnea, a condition where breathing is interrupted during sleep. You might notice loud snoring, gasping, or feeling unrefreshed in the morning. If you're waking up tired day after day despite going to bed early, don't ignore it. Feeling cold all the time is another possible sign. As kidney function declines, your red blood cell count can drop, leading to anemia. This reduces the amount of oxygen reaching your tissues, and that can make you feel chilled even in warm environments. You may find yourself reaching for an extra sweater when others are comfortable, or your hands and feet may feel colder than usual. Again, this ties back to how interconnected your kidneys are with your blood and your ability to regulate temperature. Now I want to pause for a moment, because if you've recognized any of these signs in yourself or someone you love, I want you to know something important. These symptoms don't mean it's too late. They mean your body is communicating with you. And if you listen, if you act now, you have the power to slow or even stop the progression of kidney disease. That's not a theory. That's a fact grounded in decades of medical research and thousands of patient cases. Early intervention makes a difference, and every small step you take, whether it's talking to your doctor, adjusting your diet, managing your blood pressure, or drinking more water, adds up. In the next part of this video, we'll go even deeper. We'll look at more signs that appear on the skin, in your nails, in your mood, and even in your ability to concentrate. Because your kidneys affect so much more than your bladder. They are part of your cardiovascular system, your immune system, your hormone regulation, your digestion, and even your brain health. And when they're struggling, your whole body feels it. But more importantly, when you support your kidneys with the right foods, with the right lifestyle, with awareness and consistency, you don't just protect one organ, you protect your future. Let's continue together. Let me guide you through the rest of the signs to look for and what they really mean for your long-term health. Let's talk about another visible sign that can reveal underlying kidney stress: brittle or ridged fingernails. When kidney function declines, the balance of minerals like calcium and phosphorus can shift. Over time, this affects your nails, which may become thin, brittle, or develop horizontal ridges. Your nails might peel or break more easily, and they may take longer to grow back after clipping. These changes in the quality and texture of your nails may feel minor, but they reflect a deeper imbalance in your body's ability to maintain proper mineral levels, a job your kidneys normally help regulate. Mood and mental clarity also offer visible clues. Many people with worsening kidney function experience mood shifts, becoming unusually irritable, depressed, or apathetic. You might lose interest in activities you once enjoyed or feel more mentally foggy. Everyday tasks may feel harder. Important decisions you once made easily might feel overwhelming. These cognitive changes occur because toxin buildup in your blood can affect brain chemistry. When your body can't remove waste properly, It sometimes affects how your brain functions. This doesn't mean you're losing it. It means your kidneys are struggling and your body is trying to tell you that something needs attention. Some people around us notice these changes long before we realize ourselves. Family members or friends might mention that you seem more tired, more withdrawn, or less engaged. You might not see it in yourself, but gradual changes in behavior, mood, or energy are important signals, especially if they accompany physical changes like swelling, skin itching, or appetite loss. Another sign that's often overlooked yet visible in subtle ways is gum health and oral bleeding. Kidney disease can affect your blood's ability to clot properly and may reduce platelet function. This can cause your gums to bleed easily, even when brushing gently. You may also develop more frequent mouth ulcers or experience bleeding when flossing. These changes in gum health may seem unrelated to your kidneys, but they are another reflection of impaired waste removal and disrupted blood chemistry. Digestive changes and abdominal bloating are also symptoms you can see and feel. You may notice that your belly feels swollen or tight, even when you haven't eaten much. This can be due to fluid retention or the buildup of toxins affecting your digestion. You might feel full quickly or uncomfortable after eating small meals. You may experience indigestion or heartburn more frequently. Sometimes these changes come with gas, mild nausea, or a feeling of abdominal heaviness. While these symptoms can relate to other digestive conditions, when combined with swelling, fatigue, or changes in urine, they start to point toward kidney dysfunction. Let's talk about blood pressure. High blood pressure is both a cause and a consequence of kidney disease. If your blood pressure is persistently high, even though you've been managing it with medication and diet, it's possible that your kidneys are struggling to regulate fluid and sodium effectively. This persistent elevation may not feel like a visible sign, but it may show up in visual ways, like persistent facial swelling, especially around the eyes, or fluid retention in the ankles that doesn't go away overnight. When your blood pressure remains high despite treatment, it's essential to ask your doctor to check your kidney function. Another symptom to look for is persistent tingling or numbness in your extremities. When kidneys struggle to eliminate waste, minerals become unbalanced, and nerve function can suffer. You might notice pins and needle sensations in your hands, feet, arms, or legs, especially at night. It might feel like your foot has fallen asleep, and the feeling doesn't go away with movement. These nerve-related symptoms may point toward neuropathy associated with chronic kidney disease and mineral imbalances. Around the body, pallor or unusual skin tone can be noticeable. You may look paler than usual, or your skin may take on a waxy or grayish cast. You might notice darkened patches around your eyes or mouth, and your complexion may lack its usual vibrancy. These visual changes arise because your kidneys are less able to filter waste and regulate blood cell production. Lack of red blood cells due to anemia can reduce oxygenation in your tissues, giving your skin that dull or sallow look. At the same time, toxins accumulating in the body can tint the skin. Menstrual cycle changes or sexual dysfunction may also be outwardly noticeable. Women may notice irregular menstrual cycles, heavier bleeding, or menstrual pain. Men may experience decreased libido or more frequent erectile difficulties. While these challenges can have many causes, impaired kidney function can affect hormonal balance and blood chemistry. If sexual function changes unexpectedly or PMS symptoms worsen, it's worthwhile to mention this to a healthcare provider, especially when there are other visible signs. Eyes can also reveal changes. Persistent dark circles beneath your eyes, bulging eyelids, or puffiness, especially in the morning, reflect fluid retention. Your eyes may look more glazed or watery, and in more advanced stages, you may begin to notice dryness or discomfort due to changes in fluid balance in the body. While these signs can stem from fatigue or allergies, when they occur together with swelling in other parts of the body, declining appetite, or difficulty sleeping, they may indicate kidney stress. Another change worth mentioning is frequent muscle itching or prickling sensations. This goes beyond usual dry skin. Some people describe feeling as though something's crawling on the skin, called formication, especially at night or when lying down. These sensations come with chemical buildup in the bloodstream that affects the skin's nerves and receptors. Itching is a visible symptom in the sense that you may scratch unwittingly in your sleep or develop scratch marks. If you find yourself itching for no clear reason on multiple parts of your body, that is a signal worth paying attention to. Yet another sign to observe visually is cognitive slowing or difficulty concentrating. You may find that reading or following a conversation requires more effort than before. You might need to reread familiar lines or delay in responding in social situations. These changes can show in your behavior. Once you were sharp and quick to reply, now you pause and gather your thoughts. It may feel subtle, but for friends and family, they can notice the shift. When this happens along with other signs like sleep disturbance, fatigue, or mood changes, it may point toward toxin buildup affecting brain function. Breathlessness or a persistent cough is another outwardly noticeable symptom. Difficulty breathing with minimal exertion or a cough that lasts more than a few days can be related to fluid buildup in your lungs or anemia caused by reduced red blood cell production. Your chest may sound wetter or heavier, and you may notice lower exercise tolerance. If walking upstairs or light activity leaves you breathless, or you wake up at night feeling like you can't breathe easily, that may be connected to declining kidney function. Now at count 8, 9, 10, you may ask, but I promise 17 signs, and so far we've covered visible or tangible changes. The remaining signs build on these patterns, showing how kidney disease can affect so many systems, all in ways you can observe in yourself and those around you. Let's talk about consistent low-grade fever or frequent minor infections. You might notice that you catch colds or infections more easily than before. You might run a mild fever or have urinary tract infections more frequently. Your immune system becomes weaker as kidney function declines, and your body's ability to fight off infection reduces. This can show as unexplained low fevers, lingering colds, or recurring infections, especially in the urinary tract. While those symptoms are common with many conditions, in the context of swelling, changes in urine, or fatigue, they signal something deeper. Loss of balance or coordination can be observed. You may find yourself stumbling more often or taking longer to steady yourself when standing. Your posture might change unconsciously as your muscles weaken. You may appear less steady in everyday movement, such as rising from a chair or stepping onto a curb. These physical changes reflect both muscle weakness and possible nerve involvement from mineral imbalances tied to kidney decline. Weight changes are also visible. Some people lose weight because of poor appetite or nausea, while others gain weight due to fluid retention. If your body weight seems to fluctuate significantly without explanation, especially if swelling accompanies it, this may indicate your kidneys are unable to regulate fluid balance properly. Swollen abdomen or ascites may become visible. This is more advanced, where fluid accumulates in the abdominal cavity. Your stomach may look distended or feel tight, even without eating. You may feel discomfort or pressure in your belly. Though it may first appear subtle, it often shows up as a visible change in shape or tightness of the belly. Remember, each bodily clue matters when combined. Finally, visual signs of bone changes, such as bone pain or bone tenderness, may become noticeable. Poor kidney function impairs vitamin D metabolism, calcium-phosphorus balance, and hormone regulation for bone health. Over time, this leads to weaker bones, and you may notice soreness in joints, especially around the hips, knees, or back. You may walk differently or favor one side. That subtle shift in stance or gait may be visible to others as slight unevenness or guarded movement. Now I've walked you through what feels like many signs, 17 visible and semi-visible changes that point towards slowing kidney function. I've done this not to frighten you, but to empower you. Your body speaks all the time, if you learn to listen, and each sign from swelling and urine changes to fatigue, skin tone, mental clarity, and immune resistance is your body's gentle way of asking for help. The earlier you respond, the more impact you can have. But awareness is only the first step. What matters now is what you do with that awareness. I want you to feel hope. Because even when signs are present, when kidney function has declined, the path forward still offers opportunity. I want to guide you through the next steps. Support your kidneys with hydration. Drinking adequate water helps your kidneys flush waste. But you don't need to drink gallons, you just need consistent hydration, enough so your urine should be pale yellow. If you're well hydrated, monitor your fluid intake and adjust with your medical provider if you have blood pressure concerns or fluid retention. Eat kidney protective foods. Foods rich in antioxidants help reduce inflammation and oxidative stress. Vegetables like berries, leafy greens, garlic, and onions support kidney health. Foods with lower sodium content support blood pressure. Lean proteins help reduce strain on the kidneys, especially plant-based sources like beans, lentils, quinoa, and nut butters. But always coordinate dietary changes with your healthcare provider based on your kidney function. Keep your blood pressure and blood sugar under control. High blood pressure and diabetes are the two most common causes of kidney disease. Monitoring these values regularly, adhering to prescribed medication, and eating a balanced diet low in processed foods and added salt helps protect both your blood vessels and your kidneys. Manage medications. Some over-the-counter pain relievers and non-steroidal anti-inflammatory drugs can harm the kidneys if used frequently. Ask your healthcare provider before taking these regularly. Avoid self-medication, especially if you have any signs of kidney stress. Maintain gentle movement. Exercise improves circulation and helps regulate blood pressure. It supports muscle and bone health, which kidney function indirectly impacts. Simple walking, gentle stretching, and light strength training are all beneficial. But if you have fluid overload or hypertension, work with your medical team to tailor the safest plan. Attend regular medical checkups. Ask your provider to monitor your kidney function through blood tests like creatinine and eGFR, and urine tests for protein or blood. Talk about any signs you observe. Early-stage kidney disease often responds well to diet, lifestyle, and treatment adjustments. Above all, partner with your healthcare team. Kidney disease management is not about self-diagnosis or self-treatment. It's about collaboration. You, your doctor, dietitian, and caregivers working together to preserve what's left and slow loss. And that collaboration becomes most powerful when you bring the clues from your body into the conversation. Before I close, I want you to feel empowered by this knowledge. I want you to feel hopeful. You just learned 17 signs your body may show when your kidneys are under stress. You now understand how those signs arise, from fluid retention and mineral imbalance to toxin buildup and hormonal disruption. You know that early action matters. You know that diet, hydration, movement, medication management, and medical monitoring are tools you can access. But most importantly, I want you to know that you have agency, that your body is giving you signals because it still has the capacity to heal, that you are not at the mercy of numbers or labels, that even if kidney function has declined, the goal becomes preserving function, slowing progression, and maintaining quality of life. So starting today, when you notice small changes, swelling in your ankles, changes in urine, increased fatigue, itchiness, changes in appetite or mood, listen, reach out, ask for help, tell your doctor you've noticed these signals, ask for tests, and make the simple changes you can sustain. Your kidneys may be silent most of the time, but when they struggle, your body speaks up, and you have the power to respond, to take control, to protect your future. Thank you for spending this time with me today. I'm Dr. William Lee. I'm honored to walk this path with you, and in our next video, we'll explore how everyday foods can support kidney health, reduce inflammation, and give you the strong, active future you want. Starting now. Until then, take care, stay vigilant, and believe in what's possible.